Naren, I've encountered this many times in my coaching work where, think about human nature. If you keep banging your head against the wall, at some point you're going to say, you know what, that's not fun banging my head against the wall. I'm going to stop doing that.
Yes.
And the dental analogy to that is if I'm presenting ideal care to patients and they keep saying, no, not interested, what's the byproduct of that? The byproduct of that is at some point you figure nobody's interested in this, so I'm not going to present it. And pretty soon it becomes a self-fulfilling prophecy that you end up presenting necessary care only, instead of the full range of services that you're perhaps able, to help patients with. And I think one of the biggest challenges that the dentists experience, and I've heard this, quite literally thousands of times from dentists. I've heard dentists say to me, Gary, one of my biggest challenges is when I have a patient that has a lot going on in their mouth, but nothing hurts. There's a lot going on in their mouth, but nothing hurts. How do I know whether I should present comprehensive care or just present something more basic? How do I know? How do I know? And if you're listening to this and you're thinking, yeah, that's something I encounter, if not every day, it's something I encounter probably every week. How do you know? And I'm going to share with you a way to navigate that involves your patient. It's a co-discovery. Some of you may know that I do a co-discovery workshop with my good friend, Dr. Paul Henney. It's a 2-day workshop that we do at his learning center in Virginia, where we talk about the whole concept of co-discovery. Co-discovery means that together you and the patient co-discover what's going on in their mouth, and then you co-discover the challenges that have created the problems in their mouth, and you co-discover the solutions that's going to lead them to better oral health. And now the patient is a participating, entity there. They're participating in the process, and they're more likely to have a greater interest in ideal care. And this is especially useful. Certainly, patients of any age could be a potential candidate for complex restorative care. That could be someone in their early 20s, depending on what caused the problems. But as your patient base ages, this is something much more common as we get to middle age and older, that there could be patients that could really benefit through ideal care. And before I get into the specific tips that I'm going to offer on this, I want to do some benchmarking for you. And the benchmarking here is around case acceptance. And I'm going to give you 3 different categories to start measuring case acceptance, because they're the 3 common categories we see in any dental practice. And category number 1, would be urgent care, would be there's something going on in the patient's mouth that hurts and they require a solution for it. Naren, let's just say hypothetically the patient their cheek is swollen out. They haven't slept in the last 3 nights and they're in your office as an emergency patient. Once we determine what's going on and we present that to the patient, Naren, what should our case acceptance goal be for symptomatic, meaning pain, care? What should case acceptance be?
30%?
100%.
Oh, I'm sorry. Like necessary care. Yeah, you're right.
Naren, you haven't slept for 3 nights. Tears are rolling down your cheeks. Would you like that to stop hurting? The answer is yes. That's why I'm here.
Yes. I'm sorry. I was thinking
100%. 100. Anything less than 100% on that case, well, I'll let you complete that sentence.
Right.
But we should have 100%. Now, unfortunately, humanistically, fortunately, not everyone shows up to your office in pain.
Right.
I'm going to say this playfully, and you guys know me well enough to know this is playful. I kind of wish it was in pain, because if it was in pain, you'd have 100% case acceptance. But much of the dentistry that we do or have the capability of doing, the ways of helping people, it's asymptomatic. It doesn't hurt.
Mm-hmm.
Now, when it comes to everyday general dentistry, I'm talking about everyday stuff, fillings, root canals, crowns, everyday general dentistry. For asymptomatic dentistry, my benchmark for that is 70% or above. For everyday general dentistry, typically that's stuff covered by insurance. If you're in insurance practice, insurance covers it or covers at some level. For everyday general dentistry, that's asymptomatic, doesn't hurt. If it hurts, it's 100%. If it doesn't hurt, we're shooting for 70%. Naren, how do you feel about that number? Does that number seem realistic to you? You see us measuring it with our clients. What do you think?
The 70% number, I think many of your clients do achieve it, Gary. So absolutely, it has to be realistic. Otherwise, they won't be.
It's been done before. It must be possible, right?
Yes. Yes.
Now let's go to comprehensive or ideal care. We're in a whole different world over here. Comprehensive or ideal care. Typically, it doesn't hurt. And it's something that's been going on for a long time. Let me describe a situation that all of our listeners can identify with, because you see it, if not daily, you see it every week. A new patient comes in with severely worn dentition. This is typically an older patient, might be 50 plus years old, maybe 60 plus years old, and they have little tiny nubby teeth that they have worn down to where they're maybe half the size of what they used to be when they were younger, or even less. But guess what, Naren? It doesn't hurt. It doesn't hurt. What should your case acceptance be for comprehensive or ideal care? All right, I'm going to give you this: between 30 and 40%. 30 and 40%. Now, let me give you a way to look at that. I happen to have grown up in a baseball family. In fact, my youngest brother played in the Little League World Series. They played in Williamsport, Pennsylvania. They won the U.S. championship, and they lost to Taiwan 7-1. So they didn't win the world championship, but they won the national championship. So I grew up in a baseball family. Let me give you a baseball analogy. Naren, I know that north of the border, you guys don't pay as much attention to baseball as you do to hockey. You pay a lot of attention to hockey. But in baseball, if a Major League Baseball player has a lifetime batting average of, say, 350, lifetime batting average, there is a term that we could use, that we could label that person. What would that term be? And if you don't get it, you can call a friend, Naren, I'll be your friend. What's that term?
Hall of Famer.
Hall of Famer. You got it. Hall of Famer. They're a Hall of Famer. If you have a lifetime batting average of 350, you are a Hall of Famer. You will make the Hall of Fame in the first round. Very few Major League Baseball players have achieved that standard. So what does that mean? That means you got to hit 35% of the time. That's what a 350 batting average. That means you didn't get a hit. The opposite of that. 65% of the time, you didn't get a hit. But that player is still considered a Hall of Famer. Well, I'd like to think that all of our listeners, Naren, of the Thriving Dentist Show, are Hall of Famer dentists, by virtue of the fact that they are committing themselves to learning more by listening to the podcast. I think that makes them a Hall of Famer or a potential Hall of Famer. Wouldn't you agree?
Agreed.
So, using that same analogy, anytime we're between 30 and 40%, when we present ideal care and the patient says, yeah, let's do it. Let's get started on this. Let's go. Then that's a benchmark we're striving for, between 30 and 40% case acceptance on ideal care.